moderate to severe on depression, 87% for anxiety. Diabetes, 86% and 83%. Heart condition, 86% and 79%. Lung condition, 88% and 83%. And chronic pain, 88% and 84%. So in every instance where we break down by chronic conditions, not only are we seeing bigger numbers of people with chronic conditions screening for depression and anxiety as a share of the pot, we are also seeing greater levels of severity. Now, this is consistent. This part is consistent with past data that we see greater levels of severity for depression and anxiety. But if the additional COVID-19 worry was simply driving more of the so-called worried well, people who are less ill, less sick than they've been in the past who are screening, we would not be seeing the severity numbers going up as we've seen them. We would actually be seeing the severity numbers coming down. So we think this is further indication that not only are the numbers genuinely increasing, but the severity of the impact, particularly for people with chronic conditions, is increasing as well. Next slide. So I also wanted to put this in, not to steal any of Tia's thunder later on, but maybe to set up some of what she's going to talk about. We do have a significant number of people who self-identify as LGBTQ in our screening population. And we are seeing both a significant increase in the screening numbers. You'll see the chart on the left for anxiety, the bars for January, February, and March, an increase from under 1,000 to over 1,000. And in the case of depression, from 1,500 up to closer to 2,500, 2,300 that we've seen from January to March. But we are also seeing increases in the severity level of the results. So in anxiety, the percent that we've gotten has grown from 83% to 86% in the moderate to severe category. And in the moderate to severe on depression, these have always been higher numbers than the general population. And Tia will be able to explain all that really well to us, why that is the case, if anybody is interested. But we have seen a continued increase on the positive moderate to severe depression scores from 91% up close to 94% now. So it gives you an idea of how deeply the depression in particular is affecting the LGBTQ population above and beyond what we have typically seen, even though we see an excess of this in this population in our screening. Next slide. Finally, we've asked the question, what are the main things contributing to the mental health problems right now? We started asking this question on Monday. So these are the first day of survey, first 3 days of survey results that I thought I'd share with you. 1,200 people have answered that question. They could choose up to 3 reasons. And these are the top 7. And you will see loneliness and isolation being chosen 58% of the time as contributing to mental health problems right now. COVID-19 is in second place. Past trauma and relationship problems, those would be the 2 that would typically be number 1 and 2, are now moved to 3rd and 4th. Current events has come up to 5th, which is also related to what everybody is seeing. And in fact, frankly, the governmental response or lack of response to what everybody is seeing and feeling. And then finally, number 6 and 7 are financial problems and grief. And while these are not as significant right now for people, we expect both of those percentages to be growing. So we don't think that the mental health impacts of this are going to go away anytime soon. And we think these data are suggesting that it is very specifically related to COVID-19, the loneliness and isolation people feel. And later on, we will begin to see more issues with financial problems and more issues with grief. Next slide. For more resources, I just wanted to share these particular websites with you, and others will share others, but our COVID-19 resources are at mhanational.org/COVID-19. Sorry, there's a 9 missing there, not COVID-1, but COVID-19. PsychHub has collected the resources at their COVID-19 site of Nami, of Mental Health America, and a substantial number of other mental health organizations. If you want to find all of ours in one location, you could do that at PsychHub. And to take a free mental health screen, I referenced mhascreening.org You can also get to it directly at screening.mhanational.org. Next slide. That's pretty much it for me. If you have more questions for me that you think of after this particular presentation, a particular webinar, you can find me at pgianfrido@mhanational.org, and certainly contact Mental Health America at any time if you want more information about anything that I've presented here or any other way we can be of help to you. Thanks, Mark. Back to you.
Thank you, Paul, so much. Really appreciate the data and your perspective, and I'm sure we'll be back with questions. John Brown, you are up next. Thank you.
Of course. Good morning, everyone. It is great to be here. My name is Dawn Brown, and I'm the Director of Community Engagement for Nami, the National Alliance on Mental Illness. Today, I'd like to talk to you about how COVID-19 and these incredibly strange times we're living in have created something like a perfect storm of factors that can cause serious mental health concerns for everyone. And this is especially true for people living with chronic illness or health conditions. And I'm also going to discuss what you can do to take care of yourself to weather this storm. Next slide. At NAMI, my primary responsibility is to lead the NAMI Helpline. It's a direct peer support service that helps tens of thousands of people each year with information, resource referrals, and support. When we first became aware earlier this year of the imminent health crisis that COVID-19 would create, we considered from our perspective what the impact would be on the community we serve and developed a COVID-19 resource and information guide. Along with other information, it's available on NAMI.org and has been viewed over 160,000 times in just the past 5 weeks. Now, something we knew for sure, the COVID-19 impact would be felt faster, harder, and longer among people with chronic illnesses and would have many mental health implications. So the information and resources included in the guide address these issues and provide simple, direct, and self-reliant options anyone can use. But first, let's take a look at why COVID-19 is a perfect storm. Next slide. We'll always remember before and after COVID-19. It'll be like etched into our psyche because it changed our world and it has left us feeling alone and in uncharted territory. In the normal before, many aspects of our lives work together to keep us doing well, living full, productive lives day in and day out. But now in this new normal, COVID-19 has changed all of that, and our lives in many instances are filled with uncertainty, feelings of being out of control and fearful. It is uncharted territory for everyone, and in these times, many people are telling us that they feel more alone than ever. Next slide. We've seen the impact at the NAMI Helpline too, where calls for people asking for help have increased by 40%. People out there are hurting. They're talking about isolation from family and friends because of the social distancing and quarantine restrictions, feelings of severe anxiety, depression triggered by feelings of hopelessness and powerlessness, as well as the implications of having experienced trauma. And I just want to point out, if you or anyone you know may be experiencing the onset of a mental illness or struggling with symptoms, please reach out to a physician or a mental health professional right away. It's important that we remember that help is available, and there are also things that you can do to help yourself. Next slide. So the NAMI COVID Resource and Information Guide is very useful because even when you don't have full control of a situation, and that's what's generating a lot of the anxiety we're experiencing, there are things that you can do. It brings together information and related resources that help. It addresses the feelings, the emotions, the topics and issues most commonly encountered. And you can find it easily at www.nami.org/COVID-19-guide. Next slide. Inside the guide, you'll find answers to questions most commonly heard on our helpline. Questions like, I'm having a lot of stress and anxiety because of COVID-19. What can I do? And the guide offers common sense tips for managing your media consumption, following healthy routines, taking care of yourself. And it also offers links to help find online mental health communities of people that can relate to your experiences. Those communities and those relationships will lead to helpful information and support from people who care. Other links that it offers are those that can connect you with spiritual or religious communities, as well as other great mental health articles and resources. Another one we hear all the time, I'm feeling isolated and lonely. How can I find connection while quarantined or at home? You know, there are great online peer support communities that you can tap into, as well as ways to find support over the phone. More practical considerations we're hearing include things like, how can I get my medication while I'm quarantined? Well, it offers tips and suggestions on how to acquire multiple refills and use delivery services to get those resources to you. Here's one we expect to hear for quite a while. I'm having financial trouble because of the effects of COVID-19. What assistance programs can help me? Well, we list a handful of financial assistance programs that actually are available to the majority of people, and programs that assist with medical and hospital bills and prescription medication costs. Altogether, there are over 20 pages covering 16 topics. Next slide. For us that live with chronic illnesses or mental health conditions, our lives are often more complicated, require more coordination, and at times feel more precarious than those of other people. It's at times like these that we really need to rally and focus on our needs, including being mindful of how our mental health is affected. My personal mantra, which I repeat to myself over and over again, you are not alone. There is help. You will succeed. Next slide. Be confident that the resilience and strength you've developed because of your experiences will help you weather this storm too. Remember, you can contact the Nami Helpline Monday through Friday, 10 a.m. to 6 p.m. Eastern Time at 800-950-6264 or email us at info@nami.org. And download the COVID-19 Resource and Information Guide on NAMI.org. And some good news today, the Spanish translation will be available this afternoon. Thank you for listening. Safe and be well. Thank you.
Thank you so much, Dawn. Really, really appreciate that. And I have to say the mantra, I love it. I think there's a lot to being mindful and reminding yourself of what is important. So really, really appreciate that. We're going to move now to Dr. Dole. I'm really looking forward to hearing what you have to say. Please take it over. Dr. Dole, you may be on mute. Dr. Dole, unfortunately, I am not hearing you. Well, while we work to see if we can bring Dr. Dole up, I'm going to start the Q&A. And so please encourage people to put questions or comments in the chat function. And we will ask Dawn and Paul them. Paul, I have a question for you, and it struck me when you said that the data is indicating to you that these challenges are not going to go away anytime soon. They're clearly linked to COVID-19. When I sit back, I think we're in the first phase of probably a three-part phase related to COVID-19. First phase, we're all trying to get used to being at home and figure out what the next few months are. I think over the course of the next month and a half, 2 months, we're going to start to expand out and start to get back out into life, but with a whole lot of different restrictions. I think we're probably 18 months, possibly longer before we actually get back to something that was similar to what our lives were like before. I'm curious as to how long you think this is going to continue through those different phases and how it might shift.
I agree with you that this is going to be a long time. And what I liken it to, start talking now, public officials start talking now about the curve beginning to bend, is that all that means is that we're heading into the eye of the storm. And the backside of this is going to be just as difficult as the front side was. It's just going to start as bad on day one of the backside as the last day of the front side of this. So anything that we've had leading up to this time, we're going to have tailing off at the end for weeks and months to come. And the problem on the mental health side in particular is that some of these issues that we think will arise, grief, for example, as more of us lose loved ones, and the financial worries that have not yet emerged across all populations are going to become more prominent. So I think that the back end of this storm is in fact going to be more difficult than the front end of the storm is. And like you, I think this is going to extend, even if we get a great treatment and we find a way to prevent this in the future. This back end is going to extend out on the behavioral health side for months and months to come.
I'm sure. I'm happy to. We do expect there to be something of a tsunami heading our way with relationship to the fallout from COVID-19. It won't be a simple or uncomplicated problem to address because in addition to the overwhelming adjustments people are enduring now, we'll also be faced with long-term financial consequences and actually societal changes we'll have to adjust to over time. So, for example, at the Helpline, we learned with 3-day notice that we couldn't use our call center anymore. We had to do some accelerated changing to remotely position our volunteers so they can continue to help people who are reaching out to us. Things like that, the leveraging of technology, the social distancing that will probably become more of a norm than an exception, will all be factors that we'll have to deal with over the next, I'd say, 12 to 18 months as well.
I worry about that. I appreciate that. Paul, do you have any data or insights on seniors living alone?
We do get data from people who are 55 and older and 65 and older. One of the things that is most significant in these last few weeks about this population, it's the population I happen to be a member of, not living alone part though, is that they have been less affected. We as a group have been less affected. We are showing less anxiety in particular as a result of this. I think we are more worried about our children and our grandchildren than we are about ourselves. And we've also speculated that we have been more, we've lived through more things. And so we have more perspective perhaps on this. And so right now, we are really interested in trying to understand more about why this is impacting younger people more deeply than it is impacting older people. We think we have a good handle on some of the reasons related to age and perspective, but we're not 100% sure. But initially, we would have thought that the older population would have been showing greater strain, greater stress, greater anxiety, but that's just not the case in our screening population.
Interesting. Yeah, that is counterintuitive. I'm curious from both of you if you have specific data related to people with cardiovascular disease, but in particular with youth.
Hi, this is Dawn. I do not have specific data related to cardiovascular, but I can tell you we do see a significant rise in the number of people contacting us during panic attacks. And, panic attacks can produce many of the same symptoms that people in cardiac distress can. And it really indicates to us the level of extreme anxiety people are dealing with. And so likewise, I could just imagine for people with actual cardiac conditions, how that anxiety is affecting them and their health.
I appreciate that.
Yeah, and Mark, we didn't cut these. Yeah, we didn't cut these data for youth with cardiovascular or heart disease, but because the percentages are so high on both the depression and anxiety scale for each of those groups individually, I suspect that if we did, we would be seeing results, at least in our screening population, well in excess of 90% of young people with heart conditions who were both experiencing severe depression, moderate to severe depression, and or experiencing moderate to severe anxiety.
Imagine. I'm curious from both of you, your perspectives. Getting access to mental health care has always been a challenge, and so it's probably not surprising to see the uptick amongst this group. But your general thoughts on what we could be doing in this time to support people with health and mental health needs more broadly. Dawn?
Hi, yeah, thank you for mentioning that. We are very fortunate at this time to actually have technology that makes it possible for people to remotely connect for their different mental health needs. Not all providers or practitioners participate in video therapy or telepsychiatry, but there are many options that are available. And fortunately, reimbursement by insurance companies is becoming more common than not. So always encourage people to check with their providers and to see if they have options available that they can connect remotely, because at times like this now you need it more than ever. So that's a huge advantage to have the technology that would support being able to get these services remotely.
Yeah, and I would underscore that the technology that's available to us today is greater than the technology that was available to us in telemental health just a couple of weeks ago. And even if people have gotten no for an answer, it's useful to call the insurance company again, today, because no may have become yes in the last few days. But people generally want four things, right? When they're experiencing a mental health condition or concern or crisis even. They want more information. They want engagement with peers. They want referral to services and supports and treatment. And they want often do-it-yourself tools, things that they can do themselves right away to make a difference in their lives. And we've seen this in, again, literally millions of people who've taken the screening program and then what they've asked for after that. So what I think we all can do is to really advise that people try to take the guesswork out of what they're going through. Everybody is worried. It's natural to be worried at a time like this, but not everybody finds their worry transitioning to anxiety or depression or post-traumatic stress or some other condition. So I always say to people, take the guesswork out, take a mental health screen. It's free. We offer them online. They're free. If your clinician's not offering them, we're all supposed to get them. Everybody over the age of 11 is supposed to have a mental health screen as a part of our regular well-care stuff every year, but rarely do we get a comprehensive mental health screen, even though it's just a few questions, 9 for depression, 7 for anxiety. So do it yourself, take the guesswork out, and then pay attention to what the results are. And whether you're looking for information, a referral to services, support from a peer, or some do-it-yourself tools, those things are more readily available today in the virtual environment than they have ever been available before. And you can access those. So that's what I think people should be doing, and just not guessing as much about what's happening to them or how serious it may be.
Super helpful. Thank you, Paul. It sounds as if Dr. Dole is with us now, and we may have been able to figure out the challenges with the technology. Dr. Dole, are you with us? Fortunately, we are not hearing her, so I'm going to continue with the questions. And Dr. Dole, if you are unable to get audio, please jump in so we can. I know we're getting a number of questions, and curiosity as to why the rates were higher amongst the gay populations. And so I think there's a great deal of interest in that. I'm curious, Paul and Dawn, have you looked at the issue from the context of people who may be serving in clinical trials?
If not,
No, we haven't either.
It's obviously a challenge as many clinical trials have stopped or come to a grinding slowdown. And just curious, I know we had a question earlier about that. Dawn, what about support for family caregivers and what should we be doing for them?
Right. Thank you for mentioning caregivers. That's a huge community that Nami serves, and one that's often not addressed, their needs, especially in times like these when you have different types of caregivers. People with serious mental illness will often have a caregiver involved in their lives supporting their recovery, but now with COVID-19 and so many people being ill, they also have to recruit caregivers. It's particularly stressful, and sometimes the caregivers will feel more alone than ever, especially as their loved ones find that many of the services they've relied on are no longer available. For example, my son who has schizophrenia has multiple community support services that help him thrive in recovery in his community. And I've watched them kind of drop away day by day. What I've had to do is backfill to support him in ways that he needs. And the same would be true for caregivers of people with COVID-19. You'll have to be very aware of what the needs are and how to protect yourself while delivering on those needs. Caregiving is a kind of selfless service you do out of love, so very important there. Thank you for asking.
No, thank you. Really great question from Julie Eller from the Arthritis Foundation. Starts with a comment. Our patient-reported outcome program, Live Yes Insights, has similarly indicated a substantial increase in anxiety and depression for March 2020 compared with March 2019. She asks, for other disease groups with similar PRO programs, are you seeing the same, and could we pool our PRO data together to map out how this is happening across the NHC community? It seems like a good question for you, Paul.
Yeah, I think that would be terrific. The slide I kind of stumbled over before because I couldn't see it well. Basically, the slide that helped quantify what we've seen just in anxiety and just in our screening population that generated the excess positive anxiety screens that we've seen over the course of the last several weeks over a baseline that we established for the 3 months prior to that, the sort of November to January baseline that we had of the number that we would have expected to see. Because these are all real-time data that we're collecting and that other organizations are collecting, and most people in the policy arena for our side of things will rely on data that don't become available for a couple of years as part of national surveys or as frankly reported suicide rates or things like that we don't really want to wait for. We don't want to wait for mortality rates to do this. If organizations that are also collecting real-time data would be willing to make themselves known, Mark, maybe to the Health Council, we might be able to get a group of our data folks together and just talk it through and probably come up with some additional insights in the course of an hour conversation that we could either test and look at specifically at subpopulations that we're seeing in the screening program, or that others could test for us, asking more direct questions about some of the behavioral health aspects of this. So I'm up for it because there are precious few real-time data and precious few policymakers in particular paying attention to the real-time data that are being gathered here. And if they were, they would be putting a whole lot more investment these days into this part of the stimulus package as well.
Yeah, no, for those of you who are listening, I know several groups do this. I don't know all of them, but if you want to reach out to us, we'd be happy to try and facilitate a group discussion. I know on the similar vein, we had a comment from Emily Leminska from the U.S. Pain Foundation saying that they did a survey and expected to see an increase in pain as the largest pandemic related effect on health. Instead, the most common answer was increased stress, around 85%. Dawn, you mentioned your mantra, and that really resonated with me, and I suspect it resonated for a lot of folks. I'm curious if you help others or encourage others to develop their own mantras.
Hi, yeah, absolutely. Self-talk is really important, whether you call it a mantra or whatever you choose to make it known by, but having those things that you can self-soothe yourself with and make yourself feel more powerful and in control. That's what mine does for me as I encounter situations where I feel more anxiety or depression. I can reassure myself internally by repeating these phrases. People make what works for them, but we do encourage people to use that self-talk to help them feel better.
This is Tia Dole. And I don't know if y'all can finally hear me.
We can hear you well, so
Oh my
we'd
goodness.
love to
I know.
hear
I
you
have no
speak.
idea what happened. I'm so sorry. I apologize. I'm in the middle of a very rural place and it's sort of hit or miss. I think one of the things, and I'm not going to do my whole thing, but I do want to give y'all some information from an LGBTQ perspective. So y'all don't have to go through my slides. I'm pretty nimble around this stuff. And just to frame it, LGBTQ young people are obviously at much higher risk. About 40% consider suicide within the last year. And in this epidemic, we we have access to our transcripts, of course. And what we're seeing within our service, which is that we're seeing the highest volume that we've ever seen in the history of Trevor. And about 20% of our conversations are
Unfortunately,
is
you're
less that
beating in
they
and out.
are what they're it themselves per se, but what they're worried about is what's happening in their lives. So, one of the things that and now they're living in close proximity to folks that they might have a troubling relationship with. People are going back into the closet, as it were. People are using their pronouns incorrectly, and what it's doing is creating this intense sense of isolation because now they are cut off from their normal resources. Now, I imagine that a bunch of people on this call are experiencing the same thing, but we also do know with the LGBTQ community that this is escalated. And so, one of the things that we are kind of directing our young people is to, go online, find resources, stay connected to your community. But I don't know about y'all, but if one more person suggests a Zoom hangout at 8 o'clock at night, I'm not sure if I'll be able to, to do it again. And so what we're trying to do is have young people come up with like a toolbox of resources, sort of what Don is saying, but actually sort of many resources, because one of the things that our young people are saying to us is that the things that used to work are not working, right? So the things that they've used in the past, like meditation, reaching out to people, things are sort of burning out more quickly, and they're kind of finding themselves sitting in their rooms, isolating from family members, and actually just trying to find some privacy. And so I actually, we have actually published on our website a white paper that describes all these issues and the consequences of social, physical distancing, as we're calling it. But on top of that, there's this special consideration of now no longer being able to have affirmative care if you're transitioning, things like that. So I actually, if it's okay, I wanted to actually give some advice to practitioners um, around what they could be doing. So specifically, this is directly from the young people, which is that if you are sort of engaging in psychotherapy remotely with your person, what we are hearing from young people is that the traditional psychotherapeutic model is not helpful to them at this time. Sort of like sitting in silence, saying is not helping. They actually want a more active therapist, and I get everybody has a different theoretical orientation, but just sitting in the same room is not something that young people are telling us that they're interested in. And specifically to LGBTQ young people, help with finding resources is their number one concern. A lot of folks have unstable housing, and they're, if I get COVID, this person that I'm living with is not going to be able to take care of me. Can this person kick me out? And actually, what we're finding is that people, there's a bunch of information on the internet, but not knowing what is credible information. How do I talk to my landlord? How do what happens if my roommate gets sick? Those kinds of questions, which I think in psychotherapy, I'm a clinical psychologist. We generally say to folks, I hear what you're saying. Let's, actually what young people are looking for is actually real guidance. And that's actually a really interesting thing that we're seeing now. Also just staying connected with folks, and just being flexible in the way that you do your practice. You don't need to have a 50-minute session. Sometimes 20 minutes is enough. And I apologize for this being super directive towards clinicians, but I think it's important to be flexible in this time. And then one last thing I wanted to highlight, because I don't want to take up the whole time, and again, I apologize for my technical difficulties, is I actually am in a number of peer groups with clinicians. And this is also to leaders in your organizations. What clinicians are looking for that I've connected for is leadership and guidance as well, which is sort of like a mirroring or a parallel process, right? Which is that clinicians want to be told in some ways, or offered guidance about what they can do for themselves. And so I love what you were saying, Dawn, earlier about, the mantra and everything, but I think that everyone is in some ways processed out, but then they still need more. And that's all I'll say, because I want to definitely leave some time at the end for questions. And I'm happy to send out the white paper so y'all could see what the specific issues young people are dealing with COVID.
Hey, Tia, I really appreciate your perspective. And so much of our focus here at the National Health Council is in how we can ensure that health and healthcare reflects the outcomes and the way we want to receive care. So your comments resonated strongly with me. And there was a comment from the listeners that said, as an analyst, I have seen that psychotherapy does not work. It is more solution focused and CBT. So I think you've got a lot of folks resonating with your thoughts there. We had a really great question from Gabriella Prudencio, and I hope I pronounced your last name correct, from the National Alliance for Caregiving. During the past months, hate crimes and discrimination have increased against the Chinese and Asian population. Do you have recommendations that would support this population in overcoming related stress of having to deal with discrimination? Paul, you want to take that one?
Sure. We actually have been seeing some increases also. I didn't put it into this presentation, but particular increases in anxiety severity and anxiety in the Asian or Pacific Islander population also. And so we think that we produced a paper that we put out that highlighted this and really highlighted the fact of the discrimination. I think the first thing that we can do is absolutely show support to members of that community and to call the racism and bigotry that's been directed to some members of that community by people within this country for what it is, racism and bigotry, and really you need to choose a side on this one. So it's been important to me that we choose that side. I had a daughter who was an Asian Pacific Islander young woman, and so I know that these things touch families closely as well when they see this kind of reaction. And we just need to call it for what it is. And then I think that in terms of resources and supports, we need to inquire more thoughtfully, I think, of people, what it is that they're feeling, and engaging with them. And at the same time, we're trying to publicly set people straight who are laying this burden on the shoulders of people who didn't ask for it.
We're coming down to the last few minutes, and I'm going to ask each one of you to give a closing comment. Tia, I would imagine this is a factor, and I think you touched on it, for the LGBTQ population. I'd be curious as well if any of you have any knowledge as to whether or not there's been an increase in calls to the National Suicide Prevention Lifeline. And Paul, there has been a request for more clarity on how you collected the data. I think people are interested in that. Tia, I'm going to ask you for your closing comment first.
Well, I actually do know that the National Suicide Helpline has not experienced an increase in volume, but I do know that the crisis text line has. And I think that sort of mirrors what we're seeing at Trevor, which is young people are stuck in the house with each other, and actually like making a phone call is not happening, but people are reaching out digitally. So I wonder if that's also part of that. And so just in terms of closing comments, please take care of yourself. If you can go outside, go outside. And I really think that this is going to change everything. And in terms of telehealth and how we all do business, and it would be really lovely to stay in touch with folks about what they're doing and what kind of innovations. Thank you
So much, Tia. Really, really appreciate that. And thank you for holding on and actually connecting with us today. Dawn, your closing comment.
Okay, thank you very much. And thank you for the opportunity to share. I appreciate the struggles that everyone is dealing with right now as a peer support organization. I would love to hear some of your best practices around how you can get through this time, so that we might be able to consolidate those and share them. You can reach me directly at dbrown@nami.org. And I'd also like to please say, everyone be safe, be well. Together we can get through this. And of course, always reach out to people if you need help, and the Nami Helpline is there for you. Thank you.
Thank you, Dawn, so much. Really appreciate all the great work you and Nami are doing. Paul, I'm going to give you the last word.
Okay, first, let's remember that suicide is a late stage indicator of mental health concerns. We find the earlier stage indicators in screening. So I don't want us to wait for the worst possible outcomes to assess the kind of damage that's been done by this pandemic on the behavioral health side. In response to the question about how we gather the data, I may not fully understand it. It's, as I mentioned, people find us. It's a help-seeking population. We get about 2,000 plus screenings a day, and then people voluntarily give demographic information to us if they wish, that help us collect and analyze the information. So remember, it skews toward young, it skews toward female, it skews actually toward LGBTQ, and it is help-seeking that skews toward people who have a significant mental health concern that has not yet been diagnosed, and they are not yet in treatment for that concern. That's the population. And my final words to everybody, like the others, I just want to echo Dawn and Tia: be well, stay safe, and take care.
Thank you all for an incredibly informative session. Really, really appreciate all that you are doing, and thank you to the participants. We look forward to collecting you again for a future webinar. Thank you.